Welcome to Demystifying Narcissistic Personality Disorder, or NPD. In this video, we will take a different approach to understanding NPD by exploring the concept of NPD as a shadow. Disclaimer: this video in no way serves to substitute medical advice offered from a healthcare professional. Please seek out your provider for more details regarding the topics presented throughout this video. Just like how a shadow follows us, narcissistic personality disorder, also known as NPD, can follow those who suffer from it. NPD is a mental health condition known to affect 6.2% of the population. That's millions of people worldwide. The term narcissistic is often thrown around casually. However, true NPD is a clinically diagnosed condition that can result in consequences for themselves and those around them. People with NPD have a high perception of self-importance and a lack of empathy for those around them. They believe that they are disproportionately special, unique, and entitled to special treatment, engaging in grandiose behavior and fantasies of power, success, and beauty. At the same time, they may also struggle with feelings of inadequacy, shame, and low self-esteem, which they may deny or ignore and project onto others. This can have a profound impact on their personal and professional relationships, as well as their overall mental health and well-being. Individuals with NPD may struggle to form deep and meaningful connections with others, and may engage in behavior that is harmful or destructive to themselves and others. In this video, we will take a unique approach to understanding NPD by exploring the concept of the shadow. Just like how a shadow follows us everywhere, those diagnosed also have the shadow of NPD following them everywhere. We will delve into the symptoms, causes, and challenges of treating NPD and provide insight for recognizing and dealing with NPD. This shadow of NPD exerts symptoms including fantasies of unlimited success, power, brilliance, beauty, or ideal love. They may be preoccupied with their own achievements and talents while expecting others to recognize and admire them. Previous studies have concluded that there may be genetic and environmental factors that contribute to the development of NPD. A study published in the Journal of Psychological Medicine in 2017 found that those with NPD had reduced gray matter volume in areas of the brain involved in empathy and social cognition. In another study, it was found that individuals with NPD had reduced connectivity between different regions of the brain, resulting in potential contribution to the difficulty in processing emotions and interpersonal relationships. With regards to environmental factors, some studies have found that individuals with NPD may have experienced neglect, abuse, or overvaluation by caregivers during childhood. Other studies have suggested that societal pressures to be successful and achieve a certain level of status or recognition could result in the development of NPD. So why is NPD difficult to treat? Well, those with NPD may not see their behavior as problematic and may underestimate their need for treatment due to disproportionate sense of self-importance. Therefore, they may struggle to recognize that their behavior is causing problems for themselves and those around them. Additionally, individuals with NPD could refuse to seek out for help due to these disproportionate perspectives, seeing themselves as more superior to others and unable to acknowledge any weaknesses or flaws. This can make it difficult for mental health professionals to engage these individuals in therapy or to get them to commit to treatment. Untreated NPD can result in other mental health problems such as anxiety, depression, and substance abuse disorders. Other struggles include long-term low self-esteem, perfectionism, and extreme sensitivity to criticism or rejection. While NPD is a difficult condition to treat, there are treatment options that are available. Cognitive behavioral therapy, also known as CBT, is one of the treatment options. CBT is a talk therapy that helps people identify and change negative thought patterns and behaviors to improve their mental health. CBT can help individuals with NPD understand and manage their symptoms. Mental health problems caused by untreated NPD, such as anxiety and depression, can be treated with medication. Additionally, shadow work helps those with NPD confront and integrate their shadow. They acknowledge and explore the darker parts of themselves, including any negative emotions about themselves and those around them. In shadow work, one main component is self-reflection. Here, individuals examine thoughts, feelings, and behaviors that can provide insight into how those with NPD are projecting their shadow onto others. We often hear the term narcissistic thrown around casually, whether it's in reference to a friend who loves to take a lot of selfies or a colleague who loves to boast about their accomplishments. While it's possible for someone to exhibit narcissistic traits without having NPD, it's important to understand the significant difference between normal confidence and self-love and NPD. So, if you come across someone who you may suspect have NPD, it's important not to dismiss their behavior as simply being narcissistic. It is important to set clear boundaries and communicate your needs and expectations clearly. Dismiss conversations that require power struggles or arguments, as this can stimulate escalation of the situation. Alas, we have demystified the shadow of narcissistic personality disorder. Celebrate your knowledge with these 3 questions. Question number 1. What percentage of the population is affected by NPD? A. 6.2%, B. 2.6%, C. 6.8%, or D. 6.7%. Pause this video and select your option. The option is A. 6.2%. Question number 2. What is cognitive behavioral therapy? CBT. A. CBT provides physical training to help people alleviate stress and negative emotions. B. CBT is how people use self-reflections to combat their shadow. C. CBT is a talk therapy that helps people identify and change negative thought patterns and behaviors to improve their mental health. The answer is C. Final question. What is the component of shadow work for those with NPD? A. Self-reflection. B. Tackling negative emotions. C. Tackling negative thoughts. Or D. All of the above. The answer is D. All of the above. NPD is a serious mental health condition that can have a significant impact on a person's life. However, by exploring the concept of the shadow, understanding it, and confronting it, whether that be through CBT or shadow work, individuals with NPD can begin to lead a more fulfilling and authentic life. If there is someone you know who may have NPD, seek professional help for them and for yourself to start the journey towards recovery and maintaining healthy relationships.